Hello, dear parents. Topic for today is gripe water in your child. Now, please understand that gripe water has been used for generations. Mothers, grandmothers, your neighbors have all been recommending you to use gripe water. Now, why am I talking about this? Please understand that gripe water is not recommended by IAP or IYCF. So, why is it not recommended? Let's delve into this aspect. First of all, we have to understand what are the contents of gripe water. Please understand, gripe water is a concoction which contains numerous components. Some of them from ages have been containing products like alcohol, sugars, sodium bicarbonate, artificial sweetening agents, sometimes preservatives like parabens and benzoate, herbs, and some flavoring agents like mint, cinnamon, chamomile, and others. Now let's understand what have been they used for traditionally. Basically, gripe water is used for conditions like fussiness, excessive crying, vomiting, gas trouble, colic, and teething. Now, please understand why has this product come into existence. Actually, these conditions basically are physiological. That means that each and every child, one or the other day, is going to be troubled with these problems. In allopathy, these conditions are not specifically treated, but they are usually counseled. That means we say these are all common problems, they do not require any specific medications. This creates a huge vacuum wherein mothers feel helpless. They have undergone delivery, cesarean, and they are really in a time where they are troubled. And in such a time, seeing a cranky child or a child who cries a lot makes them feel very helpless. And this opportunity is used by these products, and good marketing has established these brands for a long duration. Now, why these contents should not be used? Please understand, it is but very obvious that anything which contains alcohol is definitely going to numb you or it can soothe you down. But you understand that alcohol has some amount of addiction, and in long term it is going to cause more troubles than use. So also, as I mentioned, sugar content again soothes your child. Again, sugar has some addictive value. What happens is the child gets addicted to these sugars, and sugars should not be used in such a young child. It can cause problems to the erupting gums, it can cause bad breath or halitosis, it can be a source of infection to your child. Now, as I mentioned, the other component being sodium bicarbonate, which is again an alkali. It is the product which is used in a baking powder. This can cause, if used in excess, alkalis of your gut and something called as milk alkali syndrome, which is not a good thing for a child. As we all know that preservatives are definitely not good for your child. And again, the artificial sweetening agents again have a similar role like sugars. So all in all, these are not good contents for your child, and in long term are going to be more harmful than of use. Now, we might ask, is there actually any side effect from these products? Having understood all the problems with these contents, apart from this, there are few side effects. Some of the children might come out with rashes, allergies, itching, watering of eyes, vomiting, irritability. Occasionally, there have been cases of swelling of lip and breathing problem. There have been few reports of infections with Pseudomonas and Clostridial species. Please understand that as per the IYCF guidelines, what they say is until 6 months of your child's growth, nothing apart from milk should be introduced because his gut cannot process it. Anything which is introduced artificially can be a nidus of infection or a source of allergy. So also these products can again act in the same way. Now finally, having understood the whole thing, what I recommend, please understand that these are recommended for certain conditions like your colic or irritability or vomiting, hiccups. These all have some measures which can be done by parents which are far more effective and greatly helpful in a long way, such as gentle massages, soothing, white noise, gently rocking of your child, giving breastfeeding at the right time. I recommend the 5S technique, which I have mentioned in a separate video, and you can use these to soothe your child. And I personally, and as per the guideline, as per the standing of IIP, do not recommend use of gripe water at any age for any child. I think this was helpful to you. If so, please leave a comment. If there are any doubts, I am here to clear them. Thank you. Take care.